Welcome to the Healers Café, the #1 show for medical practitioners and holistic healers to have heart-to-heart conversations about their day-to-day lives while sharing their expertise for improving your health and wellness. So welcome to the Healers Café. And today I have Karese Laguerre with me, and she's a registered dental hygienist and a myofunctional therapist. She also founded the Myo Spot, a practice aimed at amplifying oral wellness to the whole body wellness. So I think we can, I'm going to stop with the reading there, but no, maybe I'll mention it. Tongue ties, TMJ disorders, sleep apnea, grinding, anxiety, all kinds of basically breathing and orofacial dysfunctions would be within your scope of practice and interest. So welcome. And let me ask you how you got into that field. It's not like I can't just see, a 5-year-old then saying suddenly, you know, I'm going to work in your mouth and help you sort this out. How did all this come to be?
That's a really great question. First, I'd like to thank you. I'm so happy to be here speaking with you today. I got into this field through my children. I am a mother of four,
Okay.
and those four kids, just like everybody's kids, had some problems. And I think that as parents, we always tend to give the highlight reels when people say, like, how is everything? And we're like, great. This one's in soccer, that's one's in ballet, dance recital. I mean, we're giving all of the wonderful things, but we don't talk about all the other things that are kind of lurking in the shadows in the home. In my home, not uncommon to a lot of others. My son, who is my only boy and my oldest, he had a lot of emotional and behavioral impulse control issues. Focus and attention was a big thing for him. He was diagnosed with ADHD. My oldest daughter had every sleep issue under the sun. I mean, you name it, she was struggling with it. Night terrors with blood curdling screams in the middle of the night. We would hear things thrashing around at night. She'd be sleepwalking. We had bedwetting every single night, no matter what we did, no matter how long it was before she went to bed that she drank last. Every single night for 10 years straight, we had bedwetting,
Wow.
teeth grinding, rolling, falling out of the bed. You name it, she did it at least a couple of times. Then my youngest two had a lot of different issues, whether it was from the breastfeeding and troubles and struggles that we had with mastitis and breastfeeding, all the way through their upper respiratory issues that really became such a very heavy thing, to the point where my husband at some point had asked my pediatrician to just prescribe a keg of amoxicillin for the house. That way we wouldn't have to keep coming back for the same script again and again for the constant ear infections, throat infections, congestion, and so forth. And all of those things sound, yes, one, very common. A lot of families and households are experiencing a lot of those things, but they're really similar because a lot of the origin of such I learned about through a pediatric dentist was all based in the oral facial function, how they were using their muscles, how they were breathing. And once I fell into that rabbit hole to help save my children, and I got to, really see an entirely different version in my household of, thriving and success, I couldn't help it. I was addicted. I was now very, very passionate about helping other people rediscover their children. So that's
Hmm.
my long story about how I got
No,
into
no, no,
it.
it makes sense because I was going to say there's got to be some real reason that that you pick. It's like anyway. It's well, that makes a lot of sense too, and good for you for noticing it. Like because I mean a lot of time in our culture we're sort of like, okay, well, take a pill for this or do this or oh that there's nothing you can do, just put them in another place or another corner or close the door or I mean all kinds of dysfunctional behaviors that parents take on because they feel hopeless. So yeah, so good for you for actually persevering. So well, why don't we start like since you brought up your kids, why don't we start with your son then? What changed and what could you do? What happened to him that you now do that makes sense with your, your passion currently.
Absolutely. So ADHD is one of my favorite things to talk about because my story with my son was just so long and so common, I should say. I really started with him when he was in kindergarten, I want to say. It was the first time a teacher told me that he had difficulty focusing and that he would find one of the little dust fuzzies that are floating around in a ray of sun that would shoot through the kindergarten window. And his eyes would just follow that. And he just could never pay attention in story time. And it was all sorts of things. And I'm like, well, but he's 5. So, that's fine. Then it was him in first grade, and it was like, ah, but he's 6. Like, guys, leave him alone. Of course, he's not focused. He's a 6-year-old boy. He's 7. He's 8. The excuses continue on until about 5th grade, where we took him to a pediatric neurologist, and he was officially diagnosed. Now, official diagnosis, I would like to remind all the listeners that ADHD is not something that you go and you get an MRI or a CAT scan or you do some blood work. It's the doctor that we waited 6 months to get in to be able to see had this wonderful little checklist. She asked us a bunch of the symptoms. She checked off some stuff. Boom, there it was. That's the diagnosis right there. I had to wait for that and pay a whole lot of money out of pocket for that. But that ADHD diagnosis then came along with the traditional medication.
Yeah.
That medication, we tried and it didn't work. We went through another one and it didn't work. And we went through another one, and it didn't work. All the typical stuff. We went through the Adderall and so forth. And it wound up just being sort of a dead end for us. But, that was a lot of what we were told to do. Just keep the plan and, modify the diet. But when I came into this world and learning about myofunctional therapy, what I actually discovered is that ADHD and all of the symptoms, because it's a symptom-based diagnosis, all of the symptoms of it actually have a 70% overlap with the symptoms of sleep disorders in children. So a child who is getting inadequate sleep may very well exhibit themselves as a child with similar symptoms, because there's that large overlap, as ADHD. And it turned out that it wasn't an ADHD true diagnosis for my son. It was actually a missed opportunity for that pediatric neurologist to do a differential diagnosis and to prescribe maybe a sleep study. Because when we did get him a sleep study, he had moderate obstructive sleep apnea. So he wasn't getting good quality sleep at all. And that was impacting how he was behaving during the day. And so with myofunctional therapy, it's an exercise based, wonderful way to change the way you're using your muscles. I like to say it's almost like personal training for all the muscles below the eyes, but above the shoulders. So we're working with all those muscles to help strengthen and coordinate them and establish new neuromuscular patterns, so that now when he goes to sleep, we don't have the snoring, because snoring is such a thing. Well, I'm sure we'll get into that in a little bit, but we don't have the snoring. He's able to sleep restfully and peacefully and get through and cycle all through his stages. The myofunctional therapy really did impact him tremendously, to the point where we were able, I want to say we were 5 or 6 months into the myofunctional therapy program, and we were able to just 100% write off all that medication. We didn't need that anymore. He began to thrive, and he just really needed some sleep.
Wow, incredible. Huh?
Yeah.
Yeah, I mean, it's just, and if you don't get also possibly the oxygen you need, right? I'm sure that was part of the way,
Absolutely.
you know, and then that's a stress on your whole body, right?
Absolutely.
Yeah.
Absolutely. Because that's what we need more than anything. We need oxygen. We can go for, a few days without water, a couple of weeks without food, but oxygen, you got minutes.
Exactly. So how simple are these exercises that, because I'm assuming that it's not, you don't go in just to get it done. You have to do it daily and keep a routine. So how easy are they for people to learn them?
So it's very much a commitment. I like to liken it to personal training when I'm describing it because I think that that drives home that commitment. So let's say you go to the gym, you're working out with a personal trainer, and you work out with them 1 day a week, and then you go home, you sit on the couch the rest of the week. You'll never get six pack abs, and I don't have to explain why. I think we all understand why it wouldn't happen, right? Our muscles, they really need that work and the discipline in it to,
Yeah,
facilitate change. Now, so kind of to go back to your question, it's kind of like, well, how easy are crunches or, whatever it is you're going to do, deadlifts to help work your core or help work your abs? Working muscles is as easy or as difficult as it might be, depending on your strengths or your weakness in that muscle group or muscle set initially. So for some people, it's very, very difficult and it takes a lot of discipline and it takes a lot of time to be able to get up the strength and the awareness. And working with a therapist, you're able to really troubleshoot and get a lot of the individual, you know, techniques that you would need in order to really be successful. But I like to say, on average, most people, you're doing the exercises 2 to 3 times a day. And when you're doing them, probably 5 to 10 minutes each time you sit down to do it. So maybe 15 to 30 minutes out of the day. So it doesn't sound like a lot, but we're all leading busy lives. So
yeah, yeah.
it's a commitment.
Yeah, and what about then for the children? Like, it must be hard at first until they see the benefits, right? I mean,
Absolutely. It's definitely a harder road with parents who have to really take the onus of the responsibility of exercising and making sure their kids are exercising.
yeah,
The children, we try to make it as fun as possible. We use a lot of tools and a lot of things. There's a lot of ways you can incorporate food and really engage all of those muscles, your facial muscles, your lips, your cheeks. You can engage a lot of different muscles by making it a little fun. That way, they almost don't recognize that they're exercising. It
right.
just
Okay.
also makes the program just a little bit longer, too.
Yeah, that's true, probably. Uh, so anyway, so that's with your son. So kind of a misdiagnosis turns out, though. How long did it take once you actually realized that he needed this physical kind of rehabilitation therapy um, to get him out of where he was at and getting to sleep?
Absolutely. It took, I want to say, about, he started to sleep better, not fully efficiently, but he started to sleep better 4 to 6 weeks in.
Okay.
But really, 5 to 6 months is when we were officially like, oh, he's doing really, really exceptionally well.
That's
On average, most kids are about 6 to 9 months to finish a myofunctional therapy program. So he was right there along that average.
Yeah, yeah, yeah. Amazing. I mean, if you think about it, these poor kids could be on drugs that cause them all kinds of problems that don't help them. They get labeled, they don't have normal lives, It's like, wow, it's amazing to hear that. Yeah.
Absolutely.
So then there was your daughter, that was the sleep and the nightmares, right?
Yes,
What
she had the
happened?
night terrors, the
Bedwetting.
sleepwalking and bedwetting. Yes.
Yeah.
Yes, she had all those sleep issues, and she actually was a very big thumb sucker. So, a big part of our respiration, especially at night, first phases of sleep, stage one, stage two, muscles really start to relax. And when you think about lying down and you're lying down in a bed, everything is relaxed, but then there's also gravity. And so now gravity is pushing things down too. And with her thumb in that mouth, that thumb was actually displacing the tongue from the roof of the mouth. So our tongue at rest should actually rest with the entire arch of the upper palate, that palate, the roof of the
Right.
mouth should be contained with the body of the tongue. So the tongue should be resting up and out of the upper respiratory tract, up and out of your airway. But when you've got your thumb in there displacing where that tongue should be resting, that tongue now rests down and back in the mouth. And now you've got gravity, you lay down, and everything falls backwards. And it was just obstructing her airway significantly. So we had to, one, eliminate that oral habit. And then two, really start establishing more strength and awareness for her of her tongue so that she can facilitate resting it at the roof of her mouth anytime that she's not eating, drinking, speaking.
Right. So you mentioned me. I just want to make sure I heard this right. I've understood it should be the tip of the tongue, but you're saying much more the body of the tongue.
Absolutely. The entirety of the body of the tongue.
How do
So,
you do that?
yeah,
I
we
can
could
hear
actually
it.
check to see
That's-
where it is right now. I've got a quick 1 minute test. So
Yeah.
if you put your feet flat on the floor and you sit up nice and straight and you take a deep breath in through your nose, you're going to breathe back out through your nose. And we're going to do that 2 more times. Deep breath in through your nose, back out through your nose. And as you do it this third time, I'm going to speak through it. I want you to just be really aware, really in tune with your body. Where is your tongue in space, in time, in your mouth, and the whole body of the tongue, not just the tip?
Mm.
So some might find the tip of their tongue sits up there, but the rest of the tongue might be low or in the middle of the mouth. Some might find that it just rests towards their teeth. The tongue's just hanging out in
Yeah,
that space
I
in the
feel
middle of
it.
their mouth
Yeah, right by the teeth.
by their teeth.
The teeth,
Yeah.
and then the tip is still there. So it feels like there's a gap where I'm not touching it, and the rest it's there, but it definitely relaxed up.
It relaxed up. That's interesting.
Yeah.
What we want is we want that tongue body to sit in the entirety up against the palate and not against the teeth, actually, because when it's sitting and resting up against the palate, especially more of the body of the tongue, so the back or the posterior portion of the tongue, that's going to help stimulate that vagus nerve. That's your autonomic nervous system. It's stimulating your nasal floor. And so that's going to help you respirate better because we want to stimulate the nasal floor. That's going to help you get in more oxygen, stimulate and produce nitric oxide.
Yeah.
And that's going to be the key is that tongue. I like to consider the tongue a respiratory organ. I know everybody has.
Oh, I can totally see that. Yeah. But it's interesting because I have noticed in the last while, this is not a therapy session, but hey, I will ask you. But I will listen to things because I get very relaxed and I generally sleep well. But I have this habit because my partner keeps telling me, he goes, "Are you sleeping?" And I said, "No, I'm totally listening." But I have this, as I relaxed, I have this like snoring that I can hear, but I'm not at all asleep. I'm snoring.
Are you upright or are you lying down at
No, I'm
that time?
lying down. I'm lying down.
What would your life be like if you were pain-free? If you were one of the millions who suffer from chronic pain, the thought of just one day without it may seem impossible. This is often because conventional medicine tends to fall short in the treatment of pain, opting to prescribe pills or recommend surgery rather than getting to the root cause of the problem. But if you are suffering with emotional or physical pain, there is hope. Join the founder and CEO of Bowen College, Manon Bolliger, live online for your body-mind reboot. Learn how to listen to your symptoms and get to the root cause of your pain. Plus, be trained in basic Bowen therapy moves so that you can reboot your body for optimal health. You don't have to live in pain. You can heal. Stop the pain pill cycle by visiting www.yourbodymindreboot.com to learn more and to register.
You're lying down. Okay.
Yeah.
I like to compare that then to, so imagine someone with six-pack abs, right? You
Mhm.
lie them down in a bed, six-pack abs, don't move. They're all there. That's nice, tight muscles.
Mhm.
Somebody who has more of a beer belly, you lie them down, everything shifts. All of a sudden now gravity is taking hold and things have to move and manipulate. Imagine the tissues of your throat, so your pharyngeal
Yeah.
tissues, similarly, right? So as you lie down, everything just sort of shifts. If it's not strong and facilitating in its own right, the openness of that upper respiratory tract, then you lay back, you get gravity involved, and everything just sort of starts to fall in on itself. And then
Mhm.
that's what that sound is. So when you hear a sound during breathing, because breathing in all respects, it's supposed to be inaudible. You shouldn't be
Right.
able to hear anyone breathe ever.
Exactly.
If you are hearing something, it's typically either they're congested and you're hearing it because all of those tissues are inflamed. And so that's narrowing that upper respiratory tract, or everything is relaxed and starting to fall in on itself. And that's the air. It's meeting resistance as it's going down and it's causing vibrations of the tissues, and you're hearing the sound of that.
Yeah, that's definitely what it is, because this part is all clear. So that's interesting. It's funny because I was looking forward to this interview, but this was quite a while ago since we booked it. But I bought these little tools to I haven't opened the box yet. It just arrived, but to do exercises to see if that, because it feels like it's all caving in on me, and then it makes me want to like choke, and I'm thinking this is not normal. It shouldn't be like this. So
Right.
anyway, yeah, so something like that obviously can be treated by doing exercises, and the tongue as well, like you said, it should actually lie up.
Yes, because we want to get the tongue body up and out of that airway, because the tongue is a pretty big, I call it an organ. Somebody might want to call it a muscle set, but it's a pretty big organ. And so if it's not up against the roof of the mouth, it's falling down and back. And we
Yeah,
don't want it anywhere in that upper
yeah,
respiratory space.
that makes sense. So, okay, so back to your daughter after that interlude. So the night, like the screams and the nightmares, how do you explain that as part of the picture?
So the night terrors really do fall in because her sleep stages, they weren't being well cycled.
Okay.
So a lot of the times you'll find that these children that are experiencing the night terrors, and some adults do as well, but it's primarily children, their respiration, when the body has to prioritize breathing and kind of deprioritize all of the wonderful restorative benefits that we get during sleep, the brain processing memories, and all sorts of wonderful things that happen while we're sleeping. When the body has to now prioritize that, you're not going to cycle through your sleep stages that would do all of that restorative work. So
Mhm.
you're not going to get into a really good REM. You might start to dip into it, but then your body is like, oh, nope, we can't have that. So it winds up being a lot of negative
Mm,
feedback, where instead of a nightmare, it's now like a night terror. And you wake up and you start to feel in a lot of ways like you're perishing, where you ever have a lot of those dreams back to back to back where it seems like, oh my gosh, I almost died in this dream. That's a wake up and scream for a child. That is a very much a and
right, of course. Yeah, yeah. And that obviously would impact the whole vagus nerve, like stability too, right? Yeah.
absolutely. And then during the daytime, they exhibit a lot of hyperactivity or anxiety.
Yeah, yeah. And then the bedwetting.
Ooh, the bedwetting is just the body not shutting off. So once we hit that stage of REM, we're actually supposed to be in paralysis. Like, you shouldn't be able to move. So people
Right.
who are tossing and turning, you're in stage 1 through 4 of sleep, but you're definitely not in true REM, where your body's doing all these restorative processes. It can't restore while you're moving around. So we got to shut down a lot of that nervous system. So when that body is not really shutting down all the way because you haven't gotten into those deeper cycles of sleep, that urinary tract is still on. And a lot of times it's cycling when you're in those lighter stages of sleep and you think that you're using a restroom, but you're not actually using a restroom.
Hmm. So again, fixed by working with the jaw, probably the TMJ, or
Alleviated by doing a lot of work on breathing, establishing good nasal breathing, good tongue posturing, and ensuring that the pharyngeal muscles are nice and strong and able to help self-sustain, because they're still going to relax when you sleep, but we want it to have more of that six-pack ab type of imagery where it's not going anywhere, even if you're lying down, as opposed to, that beer belly style where everything relaxes and it becomes
Yeah.
not how it should look.
Yes, okay. Yeah, it's funny in the work. Do you know about Bowen therapy, the physical therapy?
Yes, I have heard of that.
Okay. Yeah, I run Bowen College and I've been practicing it for 30 years. But so we do a lot of work with the TMJ,
Yes,
but
yes.
also the coccyx. So with bedwetting, often there's a correlation that if the coccyx is not in the right position, the TMJ goes out and vice versa. So
Gosh, it's such a
yeah,
huge connection between the mouth and the hips and the feet and everything. So, one, the fascial planes that run through that, the deep line fascia. But then, two, if you think about it, all the arches of our body really do have to be well connected and have to move in a sense together, right? So when there is a shift, that sphenoid bone is key. Is that
yeah,
what you guys talk about a lot? That sphenoid bone winds up being off, the hips tilt off, like the
yeah,
TMJ is off. There's always that deviation and deflection in that joint then. Oh, yes, you're
yeah.
speaking my love language.
Yeah, secondary breathing, as well, right? With the positioning of the pelvis, so that everything
Absolutely.
can flow, as they say. Yeah, no, that's
Yeah.
why I was super excited to hear more specifically what the work is and what it actually can treat. So now we talked about your second daughter. With you have 4 kids.
I
The
have
other,
4, yes. The
yeah,
younger 2 kind of mimic each other in
okay,
a sense.
okay,
Yeah. Both of those girls were tongue-tied. I didn't know it very early on when I was breastfeeding them, but we had a lot of issues with breastfeeding.
okay,
So I just assumed it was supposed to be painful. I just kind of rode the wave with that, but then wound up with mastitis several times. There were a lot of burst feeding sessions where it's like sucking, sucking, fall asleep, wake up, sucking, 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 fall asleep. And it's continuous where it seems like, oh, they're never really getting enough because they were sucking inefficiently or unable to really latch on well and to,
right.
facilitate getting the milk out on their own because of the tongue tie. It requires a lot of work from the tongue in order to breastfeed. The older they got, it became ear infections, sore throat, congestion, a lot of upper respiratory issues. So those ear infections, our tongue actually against the roof of the mouth, whenever we're swallowing, it actually, when it presses up against the mouth in a peristaltic or normal swallow, it's actually helping to relieve or drain our eustachian tubes. So those middle ear
Mhm.
tubes, right? Otherwise, when you're not getting that constant action, because how many times a day are we swallowing? Experts say on average, maybe 2,000. If you're not getting that and you're compressing different muscles and everything just sort of sits there, you're putting yourself at a higher risk for tinnitus and ear infections and so forth because you're not able to naturally clear. So ear infections, the sore throats, they were mouth breathers as well. The mouth breathing, there's correlation, not necessarily causation, but correlation between mouth breathing and hypertrophy or inflammation of the tonsils and the adenoids, and definitely all of that air passing through their mouth. And the only way to filter the air in the mouth is through the tonsils. That
Right.
was another one of our big issues there. So being able to really work with them on nasal breathing, establishing better tongue posture really did help us a long way.
Mm-hmm. And did you find like for nasal, because there's a lot of kids I've seen that they're breathing with their mouth, and they're positioned that way. Is that why do you think we're seeing that so much?
There's a number of reasons why we suspect it's occurring. A good portion of that has to do with how we feed our children nowadays. There's a lot of in pouches. There's not a lot of chewing that's happening very early on. So outside of the pouches, everything that you might find in a jar or a bottle is mush. And so they're not really chewing, they're not stimulating that jaw, they're not working those muscles efficiently enough. And so that winds up being a deficit for them. Sippy cups are detrimental and do not help to establish a mature oral functioning pattern of swallowing or lip rest. And so sippy cups wind up being detrimental, but the marketing on them is just so, so strong where everybody feels like, okay, after a breast or bottle, we go to a sippy cup. That is the most incorrect thing that's ever been, marketed,
Yeah.
put out there into the
didn't
world.
I didn't know that. So is it because it's the wrong positioning to
Mhm.
swallow, basically you're sucking, but you're not sucking.
Yes, exactly, exactly. It has the tongue in the wrong position. Like everything about it is very incorrect. It's only been built to help prevent spills, which
Right.
is, an
Life.
inconvenience. But at the
Yeah.
end of the day, if we're trying to get our children to develop really well and to get good oral muscle strength and awareness, they need to go from breast or bottle to open cup.
Yeah. 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 And they have cups where you can hold two sides to make it slightly easier. You know?
Yes. Yeah.
Oh, good to know. Yeah, because I have one grandchild almost coming any minute, and another one that's 9 months old. So it's interesting.
Congratulations.
It's funny at this stage, my kids, it seems like so long ago. But but I certainly notice all these little things, with the grandkids, that's for sure. Mm.
Absolutely. You want to get them away from all the pouches, all the baby foods. Baby-led weaning. It's a phenomenal book, and there are lots of support groups and organizations online to help, but it really does facilitate a better natural path into chewing and eating. Because a lot of times people don't realize it's super important for their oral development that they start to chew. That's how they stimulate our body, especially our teeth, responds to bone loading. So the more chewing and more of that munching action that they get early on, the better their teeth will erupt. You'll get through teething significantly easier. Nobody thinks about that, but that's actually why we give children teethers. It's not because they need something cold to suck on. It's because that
They need,
chewing stimulates
yeah.
it, stimulate eruption. Yeah.
Right. Wow, you're a total wealth of knowledge on this subject. It's like it seemed like you were given exactly the challenge that that sets you able to help a lot more people. So that's amazing. Any other we have a little bit of time left, not much, but anything you want to share or to wrap up this or that that you really wish I didn't ask as many questions so you could actually say something.
No, no worries. I think the really best thing that people can do if they want to do something right now, if they're like, I don't know that I can invest or commit in myofunctional therapy right now, but I want to do something to help me get a little better, invest in a nasal hygiene routine. So whether you're going to do something that's like an irrigation system, like those neti pots, and you're really flushing out, or you're just using a saline spray and you're helping to clean and cleanse out that way, make sure you're cleaning your nose. Just like you have a routine every day for cleaning your body or cleaning your teeth and so forth, you need to clean your nose. Like we said before, respiration is like key. We need oxygen more than we need food, more than we need water. We need oxygen. And so we should be cleaning out those nasal passages every single day to ensure that our body has the best chance to facilitate as much oxygenation as possible. So establish a nasal hygiene routine.
Okay, I'm gonna ask you another question though. Um, but I've heard mixed reviews about like not the breathing where you breathe through one nostril and then you switch because you're using air there. But
Mhm.
the neti pots, why do you say that they're good? Because I mean, most of the causes of inflammation are usually dietary things that we're sensitive to that we shouldn't be eating, that's inflaming the mucosa, right? But outside, which should be corrected, that's the primary problem. But
Definitely.
what does the neti pot do that I'm not aware of?
So saline irrigation is going to help clear out. So a lot of what our nose does as we are breathing is it's filtering a lot of the air. Then we have how many ways to get rid of that. You can either suck it all in. So, the kids with the sniffles, you can start sucking stuff back in and down and it goes down your throat, or you can blow it out. Not many people are doing enough of either. You might start thinking about blowing your nose when you feel something, or you might start thinking about, I don't know, a big sniff to get all that postnasal drip down otherwise. But where your saline irrigation is going to come in, it's really to help clean out a lot of that, because you're not blowing enough. No, nobody is blowing their nose enough. Nobody's cleaning out adequately enough. So it's really just going to help to clean. And then if you use one, just pro tip, if you use one that has xylitol in it, so a xylitol-based saline rinse or solution, that's actually going to help by providing just a little antimicrobial layer in there to help sort of prevent.
Okay. I guess I was happy with my chilies. I'm blowing my nose is not the issue. 'Cause I'm eating spicy food, even though probably my body's saying it's enough. But I love it. Anyway, well, thank you so much for sharing all that. Your whole experience with this, and also putting this on the map, because I don't think everyone knows that there are actually ways that you can help all of the conditions we've talked about. So thanks very much.
Thank you so much.
Thank you for joining us at the Healers Café. If you haven't already done so, please like, comment, and subscribe with notifications on, as I post a new podcast every Wednesday with tons of useful information and tips for natural healing that you won't want to miss.